How does the European health insurance card work for Americans? Imagine traveling through Europe and knowing that if you get sick or have an emergency, you can access healthcare just like a local. Sounds reassuring, right? Well, the European Health Insurance Card, or EHIC, is designed to make that possible for citizens and legal residents of European Union countries, the European Economic Area, and Switzerland. But for Americans, it's a bit different. The EHIC does not automatically work for visitors from the United States unless they have established legal residency and are covered by the social security system of an EU country. To qualify for an EHIC, you need to be insured under the public health insurance system of an EU, EEA, or Swiss country. If you live, work, or retire legally in one of these countries and are enrolled in their social security system, you can apply for an EHIC through the local health authority. Once you have the card, it allows you to access state healthcare services during temporary visits to other participating countries. Keep in mind, some countries like Denmark, Iceland, Liechtenstein, Norway, and Switzerland have specific rules for non-citizens, so check those details first. The EHIC covers necessary medical treatments that are unplanned and urgent. This includes emergency care, treatment for pre-existing conditions, and routine maternity care if you are pregnant and traveling. It does not cover private health care, planned treatments, or costs like medical repatriation back home. When you arrive at a public health care facility in a participating country, you show your EHIC. Sometimes, you might need to pay upfront and then reclaim the costs later, depending on the country's policies. For Americans, holding an American passport alone does not make you eligible for an EHIC. You must first become a legal resident of an EU country and enroll in their social security system. Once enrolled, you can apply for the EHIC, which then helps you access public health care during your travels within Europe. It's a helpful way to reduce healthcare costs and simplify access to medical services while abroad. However, it's important to remember that the EHIC is not a substitute for travel insurance. It does not cover private health care or repatriation costs. Americans should always have private travel insurance that covers private care, emergency evacuation, and treatments not included under the EHIC. Each family member who is eligible needs their own card, so plan accordingly. In summary, the EHIC works for Americans only if they become legal residents and are covered by an EU country's social security system. It then provides access to necessary public health care during short visits across Europe. Without that legal residency and coverage, Americans must rely on private insurance for health care abroad. This system offers peace of mind and financial protection, making your European adventures safer and more enjoyable.